The floods in Kwazulu Natal have wreaked havoc on both lives and livelihoods. Vital infrastructure like water pipes and sewage systems have also been damaged. Such damage can lead to a range of health risks and infections, and it's important to know what actions can be taken in response. Well, for that then, let's bring in the medical epidemiologist at the National Institute for Communicable Diseases, Dr. Linda Erasmus. Dr. Erasmus, good evening. Thank you for your time. So naturally, when one thinks about health risks associated with floods and the aftermath of floods, we think waterborne diseases. But I see from your statement that it actually goes beyond that. You've categorized that there are especially 4 main kinds of infections that you are worried about.
That's correct, and thank you for the opportunity to be here. Maybe just to speak a little, that there are actually quite a few health risks associated with flood disasters. And in fact, the most immediate events, acute events, are drowning and trauma. And then also for people with non-communicable diseases, we need to remember that there are disruptions to medication. They often lose medication. The access to healthcare becomes a problem. Systems within the healthcare, medical records, and that may also have been disrupted. So all of those systems are disrupted, and that affects people who also have chronic diseases. Obviously, healthcare infrastructure itself has been damaged often. People longer term can also get mental health issues, for example, anxiety or depression or post-traumatic stress disorder. And then obviously the other category is the infections that we get. And these can be, I think there are a few things that actually contribute to this. As you mentioned, you do get disruption of water supplies and sewage, and obviously that increases the risk of contamination of your water and diarrheal diseases. But when you have people in shelters, you've got mass displacement of people, there's crowding, the hygiene is not always easy, sanitation can be a problem. All those things also encourage the transmission of respiratory pathogens as well. So respiratory infections also happen. And then certain diseases, often in the acute events during a flood, you get soft tissue, you get trauma, and that can lead to soft tissue infections as well. And then the last two are the zoonoses, which are infections that are transmitted between animals and humans, and then other vector-borne diseases, and those are the diseases that are transmitted through the bite of an insect, of an arthropod, such as a mosquito or tick. And often changes in the environment can also lead to increases in those kind of vectors and those kind of diseases. So for example, you can get stagnant pools of water that are ideal breeding sites for mosquitoes, and we know that mosquitoes transmit malaria.
So, Dr. Erasmus, if you don't mind, let's go through these categories one at a time. Let's talk for a moment about the respiratory concerns about respiratory infections and diseases. We know that currently the biggest concern around that has to do with COVID-19. And as we are talking now, we're talking about the potential for a 5th wave being upon us. As you watch the situation in Kwazulu Natal, how concerned are you that there could be, potential super spreader situations that come about mainly because of the displacement of people being accommodated in temporary shelters and the likes?
Yes, so obviously that is a concern. We are seeing the numbers of COVID cases going up and the percentage positivity rate going up. And where you have a situation where you have crowding, where you don't necessarily have good hygiene, those are certainly potential sites for the spread of COVID, and that is one of the things that we will definitely be watching. You can also get other viral infections, and it is that time of year where we're seeing respiratory syncytial virus, we may see flu, and you may even get bacteria and things like pneumonias. And those crowded conditions, often with not really good ventilation, facilitate the transmission of those pathogens between people.
And when we talk about the other one that really jumped out at me, is the mention of malaria. Malaria, of course, it depends on the region of the country where you are. If it's a region where, which is malaria prone, that's when you really start worrying about. Not every region has that species of mosquito that can, whose bite can lead to infection with malaria. But as you watch the conditions in KwaZulu Natal, are there regions that cause concern to you? I know that, for instance, it also shares borders with areas like Mozambique, and I wonder if those are the regions where the concern is.
Yeah, so generally the transmission areas in South Africa are more the northeastern KwaZulu Natal, whereas the floods were more the central and southern parts. But it is certainly something we will monitor for and watch out for. And again, the reason for that is because the mosquitoes can flourish in areas where there's been increased rainfall and pools of water where they can breed.
I imagine then, Doc, that your teams and other teams that you work with are on the ground watching the situation. What's your word of advice for communities affected by this and those assisting them to say, let's preempt this? We know that post a situation, a disaster like this, these are the risks that come into play. Let's preempt and be proactive about it.
Thanks. So, the most important thing is obviously finding shelter for people, and then the provision of safe water becomes really important. If you need to bring in tanks of water, that becomes a really critical aspect to try and deal with sanitation and to try and encourage hand washing, and that if you do have enough water to do that. For us, surveillance is very important. So we keep an eye on what numbers of diseases we are seeing. Are we getting increases? Are they all in a specific area or a group of people? What kind of bacteria or viruses are causing those diseases? So all of those things are really important. In terms also of food safety, these things are ideal and they're not always easy to achieve in the real situation. So you can say if you're not sure of water, then please boil that water for a minute, but that's not always easy in a place where power supply and facilities and infrastructure have been disrupted. But you do also have the option of adding bleach or jig to water, and that can also purify water. And then trying to, where possible, cook food, wash hands before and after eating, certainly before caring for someone who's sick and using the toilet. So those basic things. And just to mention, in terms of bleach, we generally say using household bleach, which is about 5% chlorine. It's about 1 teaspoon to 20 to 25 liters of water. And then you mix it well and you leave it to stand for 30 minutes. And I think just awareness amongst the communities. But, as I say, these things are easy to say, but in the reality of the situation, it's not always that easy.
All right, Dr. Linda Erasmus, I've got to thank you for your time. She's the medical epidemiologist at the National Institute for Communicable Diseases, talking to us about concerns that they have, the health concerns that they have as the situation unfolds in KwaZulu Natal.